Even as statistics from the United Nations Children Fund indicate that close to 1 million children are at risk of contracting the world #1 paralysis-causing disease, the government is treating even a single case as an outbreak with the prompt response that it deserves.
So this one case of polio in Nyanza, we treat it as an outbreak, so we mounted a campaign. So we had a campaign, we finished 3 rounds of campaign, and later on we did a risk analysis, and we find that there are 129 districts in the country which are at risk of polio transmission.
After receiving the donation check from Rotary International, the Director of Public Health said it couldn't have come at a better time now that many refugees from neighboring countries have dotted parts of the northern Kenya. He was quick to note that the ongoing polio campaign has not been hampered by the doctor strike like has been the perception of many.
Bulk of our immunization is carried out in health centers and in dispensaries and in the MCH clinic and hospitals. And majority of our immunization is being carried out by nurses. The nurses are working, so immunization is still going on uninterrupted.
The World Health Organization representative to Kenya is on his part pushing for broader global partnership in order to be responsive to the needs of countries such as Kenya towards a realization of a world free of polio.
As you know, the Polio Eradication Initiative is a global initiative which is aimed at removing polio as a disease of the world, making it a polio-free world. And everywhere where a country has a challenge of polio, WHO is in partnership with other partners and the government of that country, and in this particular case, Kenya, to make sure that we assist them in planning and mounting effective campaign to make sure that the virus is stopped from spreading.
The government is further seeking to assure Kenyans of continued service of administering the antiretroviral drugs and many other services, even in the face of the continued doctor strike all over the country. Dr. Shanaz says that all public dispensaries and hospitals have not been crippled by the strike, and programs that are run in public-private partnerships are running smoothly.
Our health centers and dispensaries are working normally. The staff are not on strike. Our outpatients, especially the ones which are looking after HIV, AIDS, and TB, etc., have not been affected by the strike. So those who are TB, those ones who need their ARVs, please, there's nothing to stop you from seeking treatment. Please go for your follow-up, etc. Right? We are assuring you that the drugs are available and our staff is available.
Solomon Were, GBS News.